Hi guys, on day 4 of 25 days 25 syndrome, we are going to talk about Beckwith-wiedemann syndrome today. It is a type of overgrowth syndrome where 85% of the time it is spontaneous and 15% of the time it is maternally inherited. In these patients, there is structural changes in chromosome 11p15 along with mutations in CDK and YC or WT2 genes. It is um, it is not a classical triad, but most of the patients with Beckwith-wiedemann syndrome has classical presentations of microcephaly, macroglossia, and umbilical hernia. So now come, let's see the clinical features. So as I said already, it is overgrowth syndrome. So the patient will have macrosomia and macroglossia, and they can also have endocrine abnormality that leads to hyperinsulinemia, leading to transient hypoglycemia, and they can also have hypercalciuria in patients even without renal involvement. And if you see the neoplasia, they can have embryonal tumors like Worm's tumor, hepatoblastoma, neuroblastoma, adenocortical carcinoma, and rhabdomyosarcoma. And the organs involved in these syndromes are in abdomen, omphalocele, umbilical hernia, diastasis recti, and renal abnormalities like medullary dysplasia and nephrocalcinosis and disease can also be seen. And these patients may also have hearing loss, which is of sensory neurotype, and they can also have hemihyperplasia, which is asymmetrical development of limb. So, how do we diagnose these patients? Usually, physical features are confirmed by genetic testing, like methylation analysis and single gene testing of the CDK and IC, or we can also do chromosomal microarray and karyotype. So, how do we manage these patients? In these patients, we have to first evaluate the following initial diagnosis. Like, first, you have to assess whether they have a race deficiency, and a feeding specialist can be also consulted in case of macroglossia. And we should also closely monitor the neonates for hypoglycemic episodes by a pediatric endocrinologist, and we should also do abdominal ultrasound to assess for organomegaly or any structural abnormalities and tumors. We should also take ECG and echo if serious involvement is suspected clinically. And we should also do alpha fetoprotein assay at the time of initial diagnosis to evaluate for hepatoblastoma as well. And we can also consult a clinical geneticist or genetic counselor too. So, what are the treatments? Usually, any syndrome you take, it is genetic, so you don't have much treatment. Likewise, over here, our patient can be treated only supportive therapy and according to the disease symptoms and severity that they present with. And we should also uh, take cancer screening and follow up every 4 years for these patients. So that's it for today. I hope all of you had a great session. Please click the like button and subscribe button if you had not subscribed yet, so you can get the latest updates as I post on my channel every now and then. So that's it for today. Have a great day. Bye bye. Thank you.